Army officer, and so I was serving over in Kuwait, taking care of the soldiers.
Yeah, well, we thank you for that service, and we're glad that you're able to come back and be with us today. So let's talk about this joint health, bone health, cartilage, ligaments, tendons. There's a lot tied up in a single joint in the body, isn't there?
There is. Probably more than we have time for today.
Yeah. You are a sports physician. Well, let's put it this way. Your work is directly related to sports injuries, but those are the types of injuries that we all get because not all of us are athletes, but we all have to guard against the health of our joints.
That's true. It's sports medicine, but it also we see the weekend warriors, arthritis. We see I see concussions of with all ages, from the athletes to adults.
Guys like me who fall off of ladders.
Yes, please don't.
I'll do my best. But I can't make any guarantees.
So we take care of really the non-surgical orthopedic injuries.
Those sorts of injuries. And I think that we have this conception that when we injure a knee, when we have sprained a wrist or fallen or something like that, automatically that means surgery. That means a long period of recovery and all kinds of rehab. And it might mean some of those things, but it doesn't necessarily, does it? No.
A lot of the time, we can correct those with anti-inflammatories. Sometimes we'll need physical therapy to help us out. A lot of time, actually, the physical therapy and NSAIDs will do the trick.
Yeah.
If there's something that's severely injured, then yes, surgery may be the option, but not always.
Acute care versus chronic care. Difference, isn't there?
There is a difference. So acute care is something that's happened really recently, and usually that's more of an inflammatory process. If it's with an athlete, then it could be a tear, like we were talking about, and may need surgical intervention. The chronic injuries are some more like arthritis, degenerative changes, and those are things that we just will continue to manage over time. They may get slightly better. They might get manageable, and but we'll continue to treat it until either there's nothing else to do, or you feel good enough to go on your own.
Yeah, a lot of those are overuse type injuries.
They are.
Yeah.
Yes.
Yeah, you do something the same way for a long period of time, you're going to get some wear and tear.
You will, and I think that's what most of us will get those in some spot at some point.
So the variety of treatment options for someone in whatever sort of care they come,
sure,
that's really expanding, isn't it?
There are a lot of options. Like I said, anti-inflammatories, Tylenol for pain, those are kind of the first line. Physical therapy and occupational therapy are great modalities of treatment. They have a lot of things that they can provide in addition to what we're providing. They have heat, there's aquatherapy, there's STEM. A lot of people really like that, and they see them a lot more frequently than we do. Sometimes several times a week, and that will help to progress and improve some of the injuries. Then we have little more invasive procedures like corticosteroid injections. For chronic problems, we can start doing viscosupplementation or hyaluronic acid injections, especially for the knees, for knee arthritis, and that will help with lubrication in the knee and help to preserve some movement in the knee and make it hopefully less painful. There's platelet-rich plasma, which is something that is there's a lot of anecdotal evidence. They're still working on a lot of the scholarly evidence, but there are some good results with chronic pains and tendinopathies with this platelet-rich plasma. That is, we take some of the blood out from the patient, we'll spin it down, remove all the red cells, and inject the platelets and the plasma back in, and it has a lot of the healing factors already in it. So we're stimulating the body to heal itself faster.
We're talking with Dr. Brian Stone. Sports medicine is a really, really burgeoning field. We hear about it a lot nowadays, and certainly Indiana Regional Medical Center and the IRMC Physician Group on top of that. Are there ways that people can, we always hear about inflammation, a big problem with your health could be just inflammation within your body. Are there ways people can prevent injuries or prevent those sorts of wear and tear types of things through managing through diet or exercise or some other thing?
I mean, eating a healthy diet is always encouraged. Making sure you get the wide variety of foods, not eating too much, and that will help manage the weight. Obesity and overweight patients can have worse problems, especially with the knees over time. As far as progressing and continuing to exercise, make sure you stretch, listen to your body, don't push through. A lot of us are accumulating more and more birthdays, seems to be faster and faster, and so we need to stretch a little bit longer.
I think the rate of those is 1 per year, isn't it?
It usually is, yes. But as we get older, we need to make sure we're stretching, making sure we listen to our body. And if you start to hurt, stop.
Yeah.
And if it's getting bad enough, seek help. And so you don't have to be an athlete to come and see us. We're more than happy to see anybody who comes in with any types of pains.
Yeah.
If it's not something that I can take care of, I probably know somebody who can take care of that.
Yeah, and you can refer them outward too.
Right. And some of these things are the things that we'll be talking about next Thursday at the Touchdown to Health.
Yeah. Okay. Touchdown to Health is going to be happening on Thursday at 6 p.m. at the Hilton Garden Inn. And IRMC orthopedic team's going to be there, all kinds of folks to tell you about your health. You mentioned exercise and how, I can look out my window on any given day and see men and women jogging up and down the street, walking their dogs up and down the street. Doesn't matter what age they are, they're all out there, they're doing it. Weather's going to be getting colder. People are going to start having to go indoors now for the winter time. Doesn't mean that the time to exercise is over, does it?
Absolutely not. There's plenty of things that you can find to do inside. You can still be active. You're not going to, unless you have access to a treadmill or some kind of cardio machine, the cardio might be a little difficult. You'd have to get to a gym unless you want to run outside in the winter, which some people do, and that's fine. With that cold weather, once again, making sure you're nice and limber before you head out. Yeah. But there are plenty of things that you can do inside to maintain your health and continue to get exercise.
Yeah, absolutely. Walking the steps, just walking up and down the steps is a good thing.
Walking the steps instead of taking the elevator. Park a little bit further away from your office. Park at the back side of the parking lot and make sure you walk a little bit further to get that little bit of exercise.
Yeah, the mall walking. People do mall walking.
Do people still go to malls?
Well, we've got a nice mall here that people can walk. If people aren't going to malls, well, then that means that there's going to be plenty of space for people to go and walk.
Yes, there will.
So we would love to see them do that. Of course, you said that to see you doesn't require that you have been injured playing ball.
Correct.
They can come and see you for any reason. How do they do that? What's the information for people who want to see you?
They can call the call center. It's 888-452-IRMC or the IRMC docs.org website. Schedule an appointment. We usually have openings or we can make openings.
You going to be at the event next Thursday?
I will.
At the Hilton Garden Inn?
Yes, I will.
Yeah. Talk about that team. That's quite the team that you're putting together to do this.
Sure. So we have myself, Dr. Bone, our other primary care sports physician. We'll have Dr. Taylor, who's our physiatrist. I believe we'll have a chiropractor there, and then our orthopedic surgeons will be there, and their PAs, physician's assistants. So we'll have a pretty broad spectrum of levels of care.
Yeah. And folks can get all kinds of information, I'm sure. I don't know how it's going to be structured, but it sounds like it's going to be a great event.
From what I understand, we're going to have a big huddle at the beginning and then break out into smaller huddles. And so the guests will be able to come and see a couple of us at a table. We'll talk, we'll answer the questions, And then after a certain amount of time, they'll move on to another table and be able to talk to another physician and get their perspective.
That's a great way to do it. I like that. I like the football theme there. You break the huddle.
Right.
And you go run different plays at different tables, different quarterbacks in this case as well.
Right.
Going to give folks a number to call to get registered for that, 357-8088. That's to reserve a seat. Again, it's at the Hilton Garden Inn next Thursday, the 19th. And it's at 6 p.m. And wear your IUP football gear. They're going to have special prizes and make a real good night of it.
It'll be fun.
Yeah. And again, irmcdocs.org, 888-452-IRMC, correct?
Yes.
To get with Dr. Brian Stone, Dr. Bowen, of course, and anybody with the IRMC physician group. Hey, thanks for coming in this morning.
Oh, thanks for having me.
Again, thanks for your service, too.
Oh, you're welcome.
So appreciative of that. And, well, we wish you the best and have a great time next week dealing with all those sports injuries.
All right, thanks.
It's a Friday night. There's going to be high school football starting up, and there are going to be guys spraining ankles and wrists and knees and all that stuff.
It has already started.
It is the voice of Indiana County, WCCS AM 1160 and 101.1 FM.